Good evening. I'm Sarah Sadowski. I am here gaveling us in for City and Community Relations. I'm joined by Kara Meeker, Terry Wolf, Dr. Hebert, and we will be joined shortly by a couple of our committee members, I think. So let's start off. We are doing a summary of the Multicultural Festival. Thank you so much to the school board members who attended and tabled day of. We had, and Dr. Hubert, thank you for being there. We had tons of traffic at the booth when I was there.
Oh, wonderful.
And lots of great questions, lots of great community feedback. So thanks to all who came by the table and shared their thoughts. As far as next year, we did a cool community craft, which should be available. We did a couple of murals that are going to be available in the schools for folks to see. And we did a giveaway with Frisbee discs, which were very, very popular with the kids. So both the art and tissue paper watercolor project and the Frisbees were a great hit. And yeah, the conversation mostly revolved around middle school. And Dr. Hubert, do you have anything you want to add?
No, I would say that a lot of the conversation was around the middle school. There were some other questions in regards to employment opportunities in the district as well, but and just a few people stopped by to ask us what we saw as some of the bigger challenges we face in the as a public education system. So overall, though, I thought it was good feedback from people, and it was well attended.
Yeah, the event continues to grow in size. We had another record year, so that's fantastic. Incredible weather. Thanks so much to the organizers, and particularly thanks to Jess Campbell, our board member, who has helped secure us a space. And so that is a summary of the Multicultural Festival. Next on the agenda, we have the presentation about RPAC. Barb Higgins, we will table that for now. Kara, did you have something you wanted to bring forward around communications?
Well, first off, I just wanted to give a shout out to all the board members. We really committed to being present at the open houses in the district this year, and we got really great feedback around our presence there. I think it's just so easy for the board to be detached from the community because our job is to be here working on the budget, working on, sort of these high level things, but being present in those spaces I think is deeply appreciated, and I think that it should sort of be a standing issue for the city and community committee to address different ways that board members can interact with the community. Obviously, we already volunteer our time. I don't want to ask too much, but it just seemed like such a successful way to sort of bridge some gaps in communication, and I had a great time too, because you actually get to see the kids. We don't get to hang out with families as much as we'd like, and so I just think it was really great. So when we're talking about how we open lines of communication with the community, I do think that the board members, there's value there, and obviously we can send staff out to do our messaging for us as well, but there's a unique opportunity there that I think builds lines of trust that sometimes aren't as easy to build when we're in this more formal setting.
Completely agree. I think it was so nice to be at the different open houses and to see the board president's presence and see, the copy of How to Talk So Kids Will Listen and Listen to Kids Will Talk. Can you tell us a little bit about how those books came to be at the tables?
Actually, I don't know. I do know that I'm a brand new member to the Runlit PTO, new vice president this year. And when I showed up to table, the books were there. And I was like, these are amazing. Who did this? And I was genuinely surprised at how many people just snatched them up. I think there's a real desire to sort of in a passive way, learn about these strategies that aren't necessarily directly from the district to the parent. It's just this easy way to learn those skills. But Terry, do you know a little bit about the books? No, you just
was that at the Runlit table?
Yeah,
Yep, and at the Broken Ground.
Broken Ground. It was at CMS. Yeah,
it's one of my favorite books as a parent, plus the sequel.
Yeah, there's a teen one, right?
There's a teen one, but no, there's sibling rivalry without rivalry, and it's a really, really good book. But both of those books are really how to treat people. Yeah. Too, it's not just your kids; they're really great people skills. So I'm so glad to hear that people really like them.
Was it part of the reading grant maybe that we got? I don't know who did it, but kudos to them, and I hope we find out because it was you know, we love giveaways, right? Anytime somebody can provide materials, families love it. Tim, do you?
I was wondering if it's through our wellness, district
yep.
wellness.
Yep, that makes sense.
Yep.
Yep,
I'm
through.
pretty sure it was, but I don't know for a fact whether it was grant funded or who might have made this opportunity available, but I'm pretty sure it was through district wellness.
Yeah. It actually, I mean, even in the moment at Runlet, of course, because we're talking middle schoolers here, a parent would pick up the book and the kid would be like, ooh, you know, so it was like this, even just to like have the book present created a unique way to have a conversation with parents and kids. So, yeah, love that. Hope to do more of it.
Right. It's such a fantastic opportunity for conversation. So, also just really appreciated the engagement around the book and the informal opportunities, having the board in the community for both formal community events and informal events. I'm thinking, for example, we had the homecoming game.
I was just going
which-
to mention that. Hey,
Yeah.
well represented at the homecoming game as well on Saturday. So.
That's
Awesome.
fantastic. Yeah. So, informal events, we of course there's a food security one coming up at Broken Ground next week, thanks to Liz and folks from the Capital Region Community Food Action Program.
Yes.
Right. I think I got that acronym right.
If Liz were here, she would tell us. Yeah.
We will be well represented there. And other upcoming events that folks would recommend board presence tabling at.
I think it's worth sort of creating a list. I know, you know, there was an effort a few years ago to table at the farmers market on the weekends, and I think that, you know, that was a little more difficult because you might not have people who are there to interact with, you know, matters around the school district, and you have to get all your stuff down there and kind of sit off to the side. And while I do think it is valuable, I think these other opportunities to target our presence where families already are, where they may already be in the headspace to be talking about education and families, and you know, we could definitely come up with a list there.
I think you should consider maybe parent-teacher conferences. You could
That's
have,
a
I mean,
great idea, Terry.
because people really do like it when board members are there. They really like to connect. I know that to you guys, you're all just regular people, but to, you know, parents and stuff, you're their elected official, and they really do like to have those just quick, you know, those quick conversations. Or if they have that deeper question that they didn't have the time to write an email, or the rumor that they heard about that they're not going to write an email about. But there's a whole bunch of, you know, parent-teacher conferences, and it'll probably be similar as what you did for open house.
Yeah.
You know, and it's a great idea to actually think of. We could have a copy of the annual report. We could,
Right.
you know, we could maybe have like a to-go
Just
bag.
like a little mobile.
Yeah, like a
Right.
little to-go
Like
bag.
QR code.
Yep. Yep. And there's some things like, I just was looking at Digital Citizenship Awareness Week is coming up. That's a major initiative as part of our strategic plan, you know, as part of that wellness. So we could have different information. And Tim and I were even talking about how do we connect with parents on AI without making it a whole nother night. So we were thinking of maybe pairing some AI information on those nights so they could just kind of drop in and chat, you know, and maybe we have like a rolling presentation or something like that. You know, like it starts at 5, it starts at 5:30, it starts at 6, and then people can sandwich it in.
That's a fantastic idea, Terry. What I really like about that too is that it makes me think of the OK to Delay Coalition that's been a
Yes.
very active parent group, and they just had a very successful screen-free night last week. It was very well attended, very well organized, and so maybe even a group like that would be receptive around some of the AI
Yes.
work, because there's certainly folks who are very tuned in.
And the PTO meetings.
Yeah.
As-
All right. Well,
like,
there
if
we
there's
go.
if there's a mini presentation that could be done at PTO meetings, you know, I mean, I'm not saying we draw huge numbers at PTO, but with enough heads up, we can certainly, you know, like I know when we had the police come to a PTO meeting at Runlet last year, I think more people showed up because there was something very distinct that was happening
Right.
that was worth, you know, coming in for or staying after. While fully understanding that people's time is precious, and they may not attend every event.
But we can go to multiple events.
Yeah.
That's okay.
Yeah.
You know, and sometimes really, I always enjoy the small group discussions. You can go deeper sometimes.
Absolutely. All right, well, I'll draft up a kind of menu of opportunities for board members who are interested to table and pass it around over email. How does that sound?
Okay.
All right, great. Let's see, another proposed agenda item was around traffic at the Broken Ground School. We had a community member reach out. We just wanted to express appreciation for Matt Cashman coming out, doing some traffic work. I
Yep.
think even his presence just deters folks speeding through. Anything you want to share about that?
I know that he talked with, it's the city, I'm sorry, I'm not gonna remember the title, but it has to do with traffic and whatnot. But it has scheduled time to discuss with them potential of the markings and the lines up there, help with that. He also coordinated with the police that were up there on site during that time, going through, checking out the flow patterns, and really he's kind of putting together a plan on if we would move forward with changing things, this might be the recommended changes. So he hasn't necessarily given me that right now, but I know he was working with somebody from the city on that.
Excellent, thanks for the
Wonderful.
update. That's terrific. All right.
And do we have a date? I know this is sort of related because you mentioned the city. Do we have another Memorial Field meeting coming up, or is that on pause until we have the presentation?
I think the next one is in November.
Okay.
Excellent.
Okay. Good to know that those discussions are still happening.
Because it does make me wonder if ridership for the school buses is down overall. Do you have a sense for like what ridership is looking like?
I do not.
Yeah.
I would say where our bus drivers are down and we've condensed our routes, we're trying to maximize the use of the buses. So, I don't have a census ridership right now, but that's something we can definitely look into.
Yeah, thank you so much, because it is interesting to think about if, as the kids who were remote for COVID while they started their formative academic years, if they got habituated to, if parents and kids are habituated to the drops.
Yeah.
And if we could do.
I mean, you make an excellent point because it really is about developing habits.
Exactly.
There's inertia when you're not using the bus versus, and then when you start using the bus. So
Right.
it is habit forming.
Right, but the bus is safer, more it's, there's loads of reasons why, and it keeps congestion in the neighborhoods down as well, so.
I was talking to Principal Blinn recently.
Yes.
Do you know about his bike bus?
Oh,
Yeah.
excellent.
And he has
Will you share a little,
yeah,
Terry?
he has
Yeah.
a bike bus where my understanding is, and you might know more about this than I do, that is just groups they pick up on the way to school, and he said there's 60 to 70 kids in the bike bus.
Wow.
So that must be a lot of fun to see go by. But yeah, it's been something that they've been working on.
What a cool initiative. Thanks
Yeah.
for sharing. All right. With that, we are tabling the presentation of RPAC for the next City and Community Relations meeting. Thank you to Board Member Kara Meeker for being here tonight, and I will move to adjourn us.
Seconded.
All right, let's adjourn.
All in favor? Aye.
Aye.
All right.
Adjourned.
Nice work.
of September 24th, 2025 to order. Ms. Meeker, will you take the roll?
Ms. Boucher.
Here.
I hear Ms. Campbell's coming. Ms. Hastings.
Here.
Ms. Higgins. I don't believe she's attending. Mr. Richards.
Here.
Ms. Robinson may or may not come. Ms. Walsh.
Here.
I am here. 1, 2, 3. We have 5. Oh, Ms. Sadowski.
I am
Are
here as
you
well.
here? I
Yes,
was like, wait a
present.
minute. Something's wrong. Thank you.
Okay.
We definitely have a quorum.
Under RSA 91A23, I would like to make a motion that we allow Ms. Hastings to participate remotely. She had given us notice that her participation in meetings this week was not reasonably practical unless it was remote, and appreciate that she is making the time during her vacation to do that. Is there a second?
Second.
Well, whichever.
Second by Mr. Richards. Is there discussion? All those in
roll call.
favor? I do not believe it needs to be a roll call.
I don't think so.
Okay.
All those in favor?
Aye.
Any opposed? Motion carries. Ms. Hastings can participate. You're gonna have to shout out if you need to talk.
Sure. I'm hoping to just mostly listen, but I will let you know if I have
Okay.
anything to add or if you need me.
Okay.
We just need to establish that you can hear us and we can hear you.
Yes, and I am here alone.
Okay,
Thank you.
thank you. We are here to talk about closing out the 2025 budget, but also, finalizing the 2026 budget. But I think we're gonna start with a new wrinkle that we learned about last week, which was a unanticipated, very large assessment from school care. So I'm gonna turn it over to Mr. Dunn.
Okay, so I will turn that over to Kirsty Karpowicz from Barstow. We're gonna start out with we'll do two things. Presentation that gives you some education as it relates to trends and what is going on in healthcare. And then a presentation by the Executive Director of School Care, Lisa Duquette, who will explain how this has impacted the pool, the risk pool, and answer any of your questions, okay? So I'll turn that over to Kirsty if you just want to grab that mic. And I will operate the screen.
Thanks, Jack. Is this on?
Yeah.
Okay, thanks, Jack. So I'm Kirsty Karpowicz. I am a consultant that works for the Concord School District. Worked for the school district for over a decade at this point. And I also work with a number of other municipalities, nonprofits, and large group businesses in all around New England. So what we wanted to do was start the conversation kind of at a macro level and talk about what's going on in the healthcare market from a medical and a prescription drug trend standpoint, and then we can start kind of like honing in closer to home with Concord School District and school care. So you can go to the next slide. So there's a few sources of these, but this first one so there are these annual surveys and trend surveys that have been going on for quite some time. And they are national surveys and they kind of give a pulse of what's going on. And so there's a number of things simultaneously that are hitting the medical prescription drug market and employers. So first, 77% of employees are concerned about rising medical costs. I don't think any of this is going to sound surprising to any of us. Economic security is a big deal for employees. People are worried about AI and jobs, and we still are facing an ongoing mental health crisis. So this is kind of the climate of the work environment that we're all living in. You go to the next one. So we really want to hone in and talk about medical and prescription drug trends. And so the survey that a lot of that is sourced from is Siegel, and I just want to tell you like the scope of this data. So it's an annual health plan cost trend survey. This is the 29th year, and it's a survey of managed care organizations, health insurers, PBMs, pharmacy benefit manufacturers, and third-party administrators. And it projects 2026 cost trends for medical, prescription, drug, dental, and vision. It highlights key cost drivers and reports the actual allowed health cost trends for 2024 based on respondents' group health plan experience. This survey was conducted during the late spring to summer of 2025, and it reflects input from organizations representing more than 80% of the commercially insured and self-insured market in the United States. So those are some of the stats. When I talk about it, like, that's where they're coming from, okay? So what are we living in, all of us? So we are living in the highest annual projection cost increase for medical and prescription drugs in over a decade. I've been doing this for close to 25 years. This is just new territory. We're really in new air right now. And we're seeing the highest increase in health benefits, cost trends, and prescription drugs. On the prescription drug side, the biggest driver are specialty meds, and we'll get into what those are in a little bit. Nationally, the trend for specialty prescription drugs is running at 11.9%. We're going to show you New England in a minute because New England's higher. The primary driver for specialty are new high-cost prescription drugs. It's very common now when you have a high-cost claimant on a plan for it to be all prescription drugs. I mean, that didn't used to be the case. Usually it used to be like it would be an inpatient surgery or something. But a lot of times now it's just prescription drugs. They're doing amazing things. People are living a lot longer. There's a lot of new cancer treatments. There's new gene therapies. I mean, they're miraculous drugs. They come at a tremendous cost. And in the United States, with our employer-based healthcare system, it's putting a big burden on employers. Medical plan, so you kind of divide it out into like the medical trend and the prescription trend. So the medical plan costs across the United States are expected to go up a median of 9% nationally. And the largest driver for the medical trend, and we're going to get into this more specifically, are unit cost factors like inflation and higher utilization, and we'll get into like hospital trends. But what we see, these are national. The New England trends are consistently a lot higher than the national. So if you go to the next slide, what I did on this slide is I took all the states closest to us in New Hampshire, and then looked at all of the fully insured and self-insured large carriers and kind of took a range. What are we seeing right now for our 2026, because we're working on all these big renewals, for medical, for pharmacy, and on average. So you can see there's a range. It depends on the carrier, how the group's running, but in general, like, what are we seeing trend used for renewals? And we're seeing for medical in New Hampshire a range for the medical trend between 8 and 11 and 11.4%. For the pharmacy trend, a range between 9.4 and 20, which is unbelievable. And then for the combined, a range of 8.4 on the low end and 13 on the high end, with a ton of them coming in like the 10.5 to 11. Like, that is very common. So what is trend? So trend is, I have a procedure today. What is that procedure going to cost a year from now? All right, that's what trend is. And so, if the whole lot of claims is going to increase by, let's say, 11, that's before anything else happens. Like, that's a significant increase. So these are kind of the macro trends that it doesn't matter whether you're Anthem or Cigna or Harvard or you're a public entity or you're a private entity. It doesn't matter, because that's irrelevant. Like, this is just kind of the macro trends that are happening in the market in our healthcare environment in the United States. So if you go to the next slide. So why is this happening? So really a huge area has to do with hospitals. And there's just a lot changing in the hospital environment. The unit cost of a procedure at a hospital is a lot higher now than it was a year ago, on average. And part of that is, like, you hear about travel nurses or staff shortages. It's really challenging. Everybody's having a hard time hiring. There's a lot of financial strain. There's a lot of ambulatory surgical centers, standalone MRI imaging places, standalone infusion places, which are much lower cost than hospitals. But as all of that business leaves the hospitals, you still have the hospital infrastructure. And if you think of New Hampshire with rural places, like, you know, you go up to the Lakes region, you go up north, you got to keep that thing running 24/7. And it is extremely expensive to do it, especially when people can peel off and go to a lot of these standalone places to get kind of the higher ticket items for a lot less money. So hospitals are increasingly challenging to run and very expensive. And then there's also more utilization. So on the like office visit side, we're just seeing like more claims, more volume. So a lot of volume. If you go to the next slide. So in addition to trend, there are other factors that can really influence a particular employer group's claims, okay? So demographics, you hire people of a certain demographic, you have a ton of new babies, or, you know, whatever, you have a lot of chronic conditions. So, you know, the population changing does impact claims. You could have a really bad year of high-cost catastrophic events. That happens. You know, we'll have groups that are running great, and then all of a sudden it's like, you got to be kidding, these really, really challenging claims, and maybe that'll last for 2 or 3 years and then it'll clear up. But it happens to, no one's immune from it. And in the current environment that we're in, I mean, I'm seeing so many more claims over $1 million. And, you know, that used to be kind of a shock claim, and now it's I mean, normal might be an exaggeration, but it's very common to have a group have a claim that's over $1 million now. There's more transplants, there's prescription drugs that run over $1 million. So claims are just a lot higher. Participation in disease management and wellness. So like if you have a extremely kind of young and healthy population, then you're gonna have lower claims. Hospital consolidation and private equity entering healthcare, like those are definitely things that we're seeing impact the local market. And, you know, if there's less competition, then prices can go up. It's also really challenging when you live in a rural state. So like when we work in Maine, or we work in Vermont, or we work in New Hampshire, you know, there's just pockets where there's one hospital, you know, so it can become really challenging. And then the impact of contract negotiations between providers and hospital systems. So I'm sure everyone in this room has like read an article, and I don't care whether it's like the color of the day. It could be Anthem one day, it could be Cigna the next, with some hospital where they've come to a negotiation impasse, and all the members get letters, and it's extremely stressful. And for the population, and you know, you're worried that your doctor's not going to be covered, and usually at the 11th hour and 59th minute it resolves because both sides need each other. But it is happening with a lot more frequency now, because the hospitals will pass on a double-digit increase, and then the carrier's saying like, are you kidding? We cannot accept this. Like our rates are way too high. So both sides have to kind of figure out how they're going to come together. But that's really becoming a lot more common. And I don't think it's going to go away anytime soon. You can go to the next slide. So let's just tick through. So medical price inflation, we talked about that. Higher cost treatments, so gene therapies. You're going to start hearing more about gene therapies. So those are one-off treatments that'll run $2 to $4 million, and they're really expensive. They're becoming like they just issued one for Huntington's disease. Like they're becoming. It used to be a very kind of, they call them like a unicorn disease, and now it's moving more into the mainstream, where they're going to be treating things that more of the population would have, and therefore more health plans will be having a gene therapy claim on them. We talked about workforce shortages, the rising rate of chronic conditions. So, you know, diabetes, cancer, we're seeing so many cancer claims, so many neoplasms. We talked about the consolidation of hospitals and medical practices, and then still super high mental health and substance use claims, really, really high mental health claims across the population. On the prescription drug side, so there's so much going on. This is the highest cost area of everything. So we've got regular inflation. We've got the relentless direct-to-consumer advertising. That's all the ones you hear. You can sing all the jingles. And I will tell you what, every jingle you can sing, we see them on our high-cost claim list every day. They are all there. So there's a direct correlation between what's marketed to people, what people then go to their provider and ask for, and then what we see in the high-cost claims. And a lot of the specialty drugs are the ones that you're going to see on TV. We are seeing some biologics. So a biologic would be akin to a generic for a specialty drug enter the market, but it is slow going, and a lot of the brands will increase rebates in order to keep themselves like on the market. So there's a lot going on in the pharmacy benefit space, which isn't helping the cost for the member. The new changing drug mix, so GLP-1s, I'm sure you've all heard of Wegovy, Ozempic. There's a huge discussion, covered for weight loss, not covered for weight loss. 40% of the U.S. population technically could qualify for them covered for weight loss. They come at about $1,200 a month cost, so it's not a big shock claim. They're just like aggregate claims. It's just a ton of volume of claims, and so those across the United States or with different health plans have really been challenging. And then drug supply shortages. So what can happen is if you hear like there's a shortage of something, obviously then it increases the cost. So that can put upward pressure on the cost as well. So these are national charts of prescription drug spending, but you can see the specialty drugs running at about 11% on average nationally, drugs in general running at 11 and specialty running at 11.9. And honestly, when I looked at those seem low relative to what we see in New Hampshire claims. You can go to the next one. Okay, so we now need to have a couple deflators if we're going to talk about all the increases. So what are deflators? So one is shifting costs to like site of service or independent ambulatory surgical centers or LabCorp or Quest for labs or Shields MRI for MRIs. I mean, the variability in our state for the cost of care is unbelievable. So you can get an MRI there's one hospital in the North Country that has the highest cost MRI in the state. It's over $10,000, and you can get that same MRI at an independent freestanding facility for about $430. Same MRI, okay? So, like, there's just this enormous variability. And so that is a deflator, like, if people can access. The problem is some people have to drive a couple hours in New Hampshire to get to one of those places. Like, if you live along our corridor here, Concord, Nashua, Manchester, that's great. But if you live in a more rural part of the state, not so easy. So alternative payment models and risk-based contracting, that has to do more with like some employers contracting like directly with providers. Predictive analytics and fraud scoring. So there's a lot that's happening now with AI and coding of medical claims, and so now everybody has to catch up, right? So like if a carrier's receiving a ton of codes and it's been kind of AI's been involved, now the carrier has to kind of use AI to figure out, like, are all these codes accurate? Do we have a whole much more volume? Do we feel like it's been up-coded? Now we have to analyze it. So there's just new territory in coding, making sure things are accurate, making sure that things have been checked, making sure and sometimes that can cause a little bit of a delay if a carrier's trying to figure out whether all the codes are accurate. So there's a lot going on in that area. And then precision medicine to improve outcomes through targeted treatments. So, trying to have like values-based outcomes for care. So there's a lot that's being done to try to lower the cost of care, but I feel like just the macro trends are really, really hard to contain right now, and they just seem to be much bigger, palpably bigger than we've ever seen. I think that might be my last slide. Yep. Is that it? Okay. Any questions for me? I'm going to turn it over to Lisa. We're going to kind of get closer to Concord and school care, but yeah.
Local medical and prescription trends, I don't know what number slide it is.
Yeah.
In the pharmacy, everybody is 19 to 20, how do we get 9.4? I mean, that's good, or did
There
you
was-
forget the one in
Because what
front?
I was trying to do was incorporate every single carrier, and there was one anomaly on my list.
Can we get those people?
So I'm representing them all. So, but we're not seeing anything that, I personally am not seeing a lot that low.
So we shouldn't focus on that. We should
Would not
focus
focus
on the other
lowest
number?
of that, but that is an accurate range relative to what's been reported in the state for all the carriers.
Thank you. I have another question is, well, maybe it's not appropriate for this time, but I'll ask it later. Go ahead. I'll let somebody else ask this question.
All right.
Any questions before we jump into the school care?
Okay, I will.
If you could just
That one up.
introduce yourself for the record, please.
Yes, good evening. Lisa Duquette, I'm the Executive Director for School Care. Closer. Thank you. So just to begin, obviously, this comes at a difficult time, and we certainly understand, not only for Concord School District, that the contribution assessment that School Care announced last Tuesday certainly has significant budget and local impact. The response is in direct contrast to the rising healthcare costs that you heard Kirsty report on. So School Care has seen over the last couple years continuing escalation of claims costs and specialty pharmacy. And after much work, this was decided that we needed to do it. But we've also got a number of initiatives that I'll be sharing with you that we're working to drive costs down. Before I get into really the school care situation, I'd like to just set the table. So if we could go to the next slide, please, on what school care is. So school care is a nonprofit public entity risk pool. So all of the members in school care are owners, and not only do you own, but you govern school care. And so you have employee and employer representation, and the school care board of directors is comprised of both employee and employer representatives. So we have business administrators, teachers, et cetera, that are part of our board of directors. So unlike commercial insurance, where we're driven by profit, school care is not driven by profit. Each and every year, based on state statute, RSA 5B, there is what I would refer to as a shoring up of, is there any surplus in the program? And then we return that surplus. And one of the benefits of pooling, and school care has certainly, like school care, many other pools have been able to demonstrate that we've been able to provide about 10 to 15% annual savings to the members in the program when compared to commercial insurance. But being in a risk pool means not only when we have surplus and we return that, it does mean that when there's a deficit, that there can be a contribution assessment. And we've seen this happen throughout other pools in the country. This is not unique to New Hampshire. Unfortunately, we're in the situation we are today, and quite frankly, New Hampshire has enjoyed 40 years of public risk pooling and not had an assessment previously to this year. The member contributions are our only source of revenue, right? So we're collecting in contributions from all of our member entities. We're paying out the claims on your behalf. We purchase stop loss because we need to mitigate those large, high claims. But at the end of the day, this is the fundamentals of pooling and on the basis on which the rest of what I share with you about the assessment is built. If you could go forward, Jack. So let me just start with a little bit of backdrop, right? So it seems like it's new information that School Care has released, and we have been following it very closely. I'm going to back up a little bit. I'm actually trying to go forward, and I shouldn't be. Let me just start by, in order to get where School Care was at, our board has utilized a number of experts. So School Care has its own actuary, its own independent auditor, legal experts. And through this process, we have not only utilized those experts, but over the last 30 days, just over 30 days, we have also brought in other experts. We brought in a secondary actuary, a secondary accounting firm, and additional legal experts. And I will tell you that all of that was supported by the regulator, the Secretary of State. So on August 19th, when we got the actuarial reports that I'm going to talk to you a little bit about later, we immediately called the regulator. And they said, we want to help. We want to figure out what this is. We know what the impact is to local municipalities and schools. And so each week thereafter, our board, the regulators met, and all of these consultants met. So the bottom line is that the deficit is due to multiple years of high claims experience. At the annual meeting last year in November, but also reported at our public hearings last October, we shared that the trend used to set rates was just under 7%, and that we had experienced 10.9% trend in actual claims. That was for fiscal year 24. As we wrapped up fiscal year 25, and we knew that claims were high, we've been monitoring very closely, been reporting it, claims experience was 13.3% compared to 7% trend that was used for fiscal year 25. And the higher costs are driven by utilization, a lot more individuals with claims over 100,000, some of those being specifically pharmacy. We also had a challenge in the pharmacy area in a different way. School care receives significant pharmacy rebates from Cigna, that's our provider, and we put those 100% of them right back into the rate setting process. And so we expected to put all of those back, and unfortunately we only collected 2/3. There were a few contributing factors. One is we had a number of biologics. So some of those folks went off specialty medications and went on biologics, and there was no more rebates. So we had lower costs, but we lost significant rebates. We've also discovered that there are a number of, at the federal level, conditions upon which prescriptions are no longer rebatable. And so we lost rebates that were expected there. In essence, the combination, most of it claims related, a little bit of it pharmacy related, is what really created the deficit situation that we're in today. And it's unprecedented. Next slide, please. As we go through, I just want to make sure folks know I'm going to keep getting a little more detailed in terms of setting the framework. So, as we've talked about, this is School Care's first ever contribution assessment in 30 years. And it's because claims are exceeding contributions. Now, in Concord School District's case, the district over the last just over 10 years, 2012 through 2023, School Care has issued just under $6 million in contribution holidays to Concord School District. And that's because each of those years, from 2012 to 2023, we had surplus in the program every single year. 2024, we did not. And here we are in 2025 with a different situation on our hands. And that assessment today is just under $2 million for Concord School District. So let's talk about how did we get there, because I think that's a really important question. I've been trying to lay some of the framework for you. But, is this a surprise? Did this come as a shock? No, it didn't. Let me explain a few of the things, what we did last year and what brought us to the point today. So I mentioned last year that the public hearing, we shared that we had high claims experience, and we shared that we had had a $10 million loss. That $10 million loss then, based on feedback at public hearings and based on the board of directors, it was determined that we would rebuild that $10 million over a 3-year period of time. And what that meant is that for the rates for July 1 of 2025, which we were very transparent with, had a 2.3% load, if you will, to rebuild that $10 million reserve. And so the rates the Concord School District is paying today has part of that in it. Now, you know, that 2.3% clearly was not enough. And what's happened now a year later is not only did we have $10 million in losses last year, but we, as of this June, had used $20 million in reserves. And that brings the reserves critically low, brings them down just under 10 million. And when you do actuarial studies, they project out into the future and they say, are the contribution rates that you've provided adequate to cover what we now think are going to be the claims a year later? And the answer was, no, they're not sufficient. And this happened to us now twice in a row. So last year, we expected that the rates for fiscal year 24 were going to be short by 5 million. And it was in that $10 million loss that we shared. Unfortunately, they didn't come in $5 million short. They came in just over $10 million short. Now this year, here we are, we've got the rates, we put the 2% add in there for the rebuild, and they're still not adequate. Even with the 2.3%, the actuaries are projecting another $12 million shortage in the rates. Because we've got this escalating 10.9, 13.3, and everything resets that bar that then you add the new trend numbers onto. And so what's projected, and you may have heard some statements being made, that we have a $4.5 million deficit. And that deficit has to be recorded at June 30th of 2025. We aren't there yet. Okay, that's based on the actuarial indications, but we will be there by April based on those projections.
June 30th, 2025 or 2026?
2025.
That already happened.
So it happened.
You have to record it. Actually, it's an accounting entry. But we
I
had to
understand,
record
but
it.
you're saying it'll happen by April. So you're throwing around a lot of numbers and a lot of years. So I just want to understand. These are claims that already happened in the previous fiscal year that will be booked throughout the year and attributed to 2025?
No. So there are some that are attributable. There's about $5 million that was attributable to fiscal year 2024, approximately $10 million attributable to fiscal year 2025, and nearly $15 million that will be attributable to the year that we're in right now.
Fiscal year 26.
That's correct.
Okay.
Did I misspeak? I'm sorry.
Yeah, you said fiscally will be attributed to June 30th, 2025. That's why I was confused.
Okay.
The $4.5 million.
Apologize.
So go on.
That is correct from an accounting standpoint, because you have to record those at June 30th of 2025.
But you don't have to pay them until April?
We have to pay them through the year, and it's expected by the end of April that without the assessment, school care would not have any reserves or cash to pay claims much beyond April 30th of 2026.
Okay, thank you.
So really what's happened is school care has signaled the problem early. We're not waiting till the spring and finding out that we can't pay your claims. We validated it with a number of experts. We have framed up what we believe to be a fair model in terms of the assessment. We have built in some time, which I'll be describing in a few minutes in terms of payment of that, and with the intent that that provides some flexibility and budgeting pathways to members. But without this corrective action, the stability of the pool is at risk. Next slide, please. So let me tell you a little bit about the data-driven part of the assessment. So first and foremost, it's $30 million and it's pro rata. It is on the basis of member contributions. So what we do, and it's the same basis that we use for contribution holidays. We look at the contributions for the fiscal year ending June 30th of 2025, and each member entity's pro rata share of those contributions are then proportioned to the $30 million assessment. It's applied to those members as of June 30th, 2025, since those were the members that created the deficiency. We looked at a number of different data-driven reserve levels to rebuild to. School care historically, over the past 15 years, has maintained reserves in the range of 14 to 16%. We looked at a variety of targets. We looked at 8% of member contributions, 12% of member contributions, and all the way up to 16% of member contributions. And ultimately, the board made the decision that this middle-of-the-road 12% seemed to be most aligned with school care's historical levels, maybe a little bit under, but seemed like a reasonable level to rebuild to. It was also consistent with the actuarial recommendations that we had. I think the rest of that is self-explanatory. I will tell you that school care did have some growth in its membership on July 1st, about 10% growth in membership. Those members are not participating in the contribution holiday since they were not part of the creation of that loss. We do, however, believe that those members will continue to help school care build strength in the future. So a couple things. I shared how we've tried to create this pathway with some understanding of local budget constraints. So the invoices will be issued on October 1st. They will have a 90-day grace period, and during that grace period, there's no interest accrual. After that 90-day period, beginning January 1 of 2026, there will be an interest charge. It's 0.5% per month or 6% annualized. We used this amount because we are working very closely with one of our banks to obtain a bridge line of credit should that be needed if claims continue to escalate. And so the thought behind this was providing members with a pathway to payment, but also those who didn't pay prior to January 1 to participate in the cost of that line of credit that we're working on. The intent is that any groups that have a intent to pay in the next fiscal year would be notifying us prior to May 1st, and we would just continue on the same path. However, if there are any groups that indicate they're unable to pay or unwilling to pay, we will need to put a claims hold on their claims as of May 1st, 2026. And if they do not pay by, that's July 25th, keeps popping up in here, it's supposed to be July 15th, then we will be in a situation, unfortunately, where we'll be telling Cigna to deny claimant of the claims, and unfortunately, the covered individuals would be responsible at that point. We're truly hoping that it does not come to that point. And so a little bit just in wrapping up here, in terms of stability and next question. So we've really had to take a look at everything to see what we could do. And I will share with you that even though we were in the middle of a contract period with Cigna, they have come to the table, and we've been able to secure increased pharmacy savings plus increased pharmacy rebates to the tune that the contract is set to change January 1, 2026, and it is currently under review by the actuaries, but we believe that it is going to provide over $5 million in annualized savings back to the program starting in 2026. We're also doing a lot in terms of reviewing vendor programs, looking at programs to improve value, and control costs, and do things like further enhance complex conditions. So some of these very complex, high-cost claims, working to see where we can support those individuals in terms of their future health. And then internally, we've taken some internal steps as well. So we've put on a hiring freeze. We have excluded non-essential travel. But we're doing a number of things internally to look at where we can cut costs as well. And I will share with you that we're continuing to commit to the transparency and, collaboration with our members to share all of those efforts and what we've been able to achieve through that. I do believe the public hearings that will be on October 16th and 17th will detail more about what all of those various savings are that we've been able to achieve, because we're envisioning being able to show what the renewal would be before these steps are taken, and then what each one of the steps is able to achieve. And then just last, I just want to reiterate that we are here. We are a member-driven organization. We listen to our members. We are committed to being transparent, offering stable rates, and member-focused benefits for your employees. That's it for my comments. Thank you.
Thank you for coming tonight. I'm glad to hear it wasn't a surprise to you, but this is a huge surprise to us, a quarter of the way through our fiscal year, having to come up with $2 million. There's 80% of our budget is teachers and staff and their salaries and their benefits. They're in classrooms teaching kids. We don't have a lot of places to go. We're better off than a lot of other school districts in the state. One question I had is that you said going into fiscal year 24, it was a 10% increase in claims over your 7% projected trend. But then you used 7% again in 25?
So 1 year it was under 7%, 1 year it was over 7%. But you don't actually typically know those numbers. You're using benchmarks that you have from the actuaries. So truly what's happened is the actuaries, including the big names that publish the reports that Kirsty shared, really haven't been able to keep up with this in terms of the rising healthcare costs. They just weren't able to make projections that were on point.
Some of the claims losses that you're expecting are coming from this fiscal year, right? The reserves we're rebuilding are not just from previous year's losses.
That's correct.
So are the new members going to see an adjustment in their rates so that their rates are more realistic compared to what the claims experience is for the pool?
I'm sorry, I don't know if I understand the question.
So you said only members before June 30th, 2025 are being assessed.
As of June 30th.
But but I'm wondering if their rates are representative of the actual costs that you're seeing. And if they're not, then shouldn't they be contributing to the increased costs?
So they weren't part of the projections for the losses this year. What we do get from them, and this is digging a little bit deeper into the processes, what's really important to understand is each group, we're looking at their claims experience. And so we will have the claims experience for the new groups from their prior provider, and that will be used to set their rates.
For this year or next year?
No, it was for this year because they're new as 7/1/25, so
Okay.
that was used for 7/1/25. And then as well for 7/1 of 26, we'll be getting their updated claims experience, and we'll be using that to set their rates.
But in the meantime, they could be contributing to the losses that we're experiencing this year that we're being assessed to make up for.
And they would, if they do, then they would be paying for it next year.
In rebuilding reserves or in just their rates?
In their rates, because they wouldn't have pulled down on the reserves.
I mean, that seems like a little bit of money is fungible, because if they're over what you have predicted in trends, it's coming out of the giant pool, right? So they could be, if they're 102% of what they're paying, that's hitting the reserves too.
I want to just refocus. It's a member-driven organization. Everything is done in a manner consistent across the members. We will be looking at each member's claims experience, just like when we go to set rates for July 1 of 2026 for Concord School District, your claims experience will be part of your rate increase. So we may have a broad range of increases from, let's just say, single digits to double digits. And it'll always be based on the claims experience of the group.
I understand that, but we're being assessed to pay for building up a pool that will benefit potentially these other districts too. And and that assessment is all going to happen in this fiscal year. So in theory, the reserve will be rebuilt and they won't have to contribute to what they might benefit
They
from.
aren't part of the calculation of the needed reserve. Their needed reserve gets built into their rates for the first year. So the needed reserve is for the members as of June 30th of 2025. No members as of June 30th, 2025 are contributing to building reserves for new members.
Okay, thank you. Questions? Mr. Richards?
Yeah, so, looking at whether we'll get a $30 million assessment next year, surprise, or not, or whatever, I'm assuming the reason you're anticipating we're not is because you're going to significantly increase our rates in the next coming year. And I believe you mentioned double digits. Is that what we should expect?
So on average, school care is expecting a double-digit increase next year, very consistent with what other self-funded plans are experiencing, as well as the commercial market, which in some cases may be even higher. This is intended to be a one-time assessment to pay for this year's claims and rebuild the reserves from the prior year. And again, I can't speak to what Concord's renewals have going to be. I can share with you, just like our commitment in the past to stable and fair rates is where we will going forward. It's really going to be dependent upon the claims experience of each group, and then you share in a pooled environment in terms of overhead costs, and then we also pool the large claims.
But over the last 2 years, you significantly underestimated what actually happened. And so why will not that, are you going, why should we be, or should we be concerned that you are underestimating what will happen in this coming year? And what are you estimating?
I think what's really important here is that we focus on that school care is utilizing a number of expert actuaries. So these are the actuaries that have taken a new look at it. We've had a second actuary brought in, and they have given the very best estimate of what they believe. We've had the regulators look at it. We've had accountants look at it. But there is nothing when we look back historically that signals something different should have been done sooner than it was.
I'm not pointing fingers at you or anything like that. I'm saying that we have to be prepared to not only come up with $2 million this year, but there is a very high variability of what it could be next year, because you didn't know what happened this year. What's to say you will know what happens next year? And we have to factor that in to our financials and to our budgets, and that's what I'm trying to get a little bit of a feel for. We were not able to spread this over 2 years, right? We're spreading it over at best 3 months. And that's a very difficult position for us to be in, because that's $2 million. So I'm looking not only at this year, but I am looking at next year, where in addition to double-digit increase in rates, we could have to, if your estimates are not accurate, rebuild the pool or whatever your assessment is, your 30 million back again. And then that's a possibility. Am I correct?
That is not the intent. This is intended to be a one-time contribution assessment. When we look at what's going on across the country, historically and even currently, we could have taken this in a multi-year approach, but our concern was that if we did that, it was going to penalize future members. If members left, then others would be left having to pay for the reserves or the prior losses of those members. And so we did find a middle-of-the-road solution that we thought was fair and reasonable.
I appreciate that. I'm just looking at risk in the future.
I can't project that, sorry.
No.
Ms. Meeker?
Hi. Just because I'm trying to wrap my head around the different assessment amounts for our different members. So like, for instance, we are receiving an invoice for $2 million. Is it distributed through all your members at that 12%? Is that where that is? Like, Why is, like, let's say, why is our neighboring district only being charged $1 million and we're being charged $2 million? How is that being
It's
assessed?
pro rata based on your Concord School District's contributions as a portion of School Care's total contributions for fiscal year ending June 30th of 2025.
Okay.
So if it's a group with smaller, so say a group had $1 million, if Concord School District contributed, and I'm just going to use round numbers, $12 million last year, and another neighboring community or school district contributed $6 million, then yes, their contribution would be half
I see.
the amount that yours are. It's all pro rata based on contributions.
Gotcha, thank you.
And we have anywhere from about $1,000 to about $2 million.
Yay, we're in the lead. And that is on top of the 2.3% that was built
Right.
into our rates for this year.
That is correct.
When did you guys know about this, and why didn't you let school districts know earlier?
So
You said it wasn't a surprise, but like, why didn't you let us know? Why didn't you let us know earlier? I mean, that's the part that is really sticking in my craw.
I'm gonna go back and I feel like I've shared this, and I'll just kind of repeat just to make sure it's clear. It started last year when we wrapped up our audit, and at public hearings and the annual meeting on November 1st last year, we shared that that School Care had experienced a $10 million loss. We shared information about our claims experience. We go through the year, and yes, we expected to have another $5 million loss during the year. That was part of expected and planned. We get through 3/4 of the year, and we seem to be on target. April, May, and June of 2025, claims escalated significantly. And we were watching them. So then we needed to have our typical annual actuarial work. On August 19th, we received that actuarial report, and that's when it confirmed not only, and we still pay claims, right? We're still paying claims for last year all the way to December. So they anticipate what we're going to be paying through December of this year for claims for last year. And that's when we saw that the number was going to be not 5 million, but 10 million, as we paid what's called run out. They also do another study. They then look at your contributions based on the new rates for July 1 of 2025. And then they look at past claims experience, and they project based on that what the claims experience is going to be using updated trend numbers. And that's where they came up with almost another $15 million deficit. So August 19th, in the evening of August 19th is when we received that actuarial report. On August 20th, the board started meeting on a weekly basis, was engaged with multiple additional resources, those extra actuaries, lawyers, Secretary of State. They attended every single meeting. Every meeting was held in public. There was no non-public sessions. We're subject to 91A, just like all our members are. And the board made a decision on the evening of Sunday, September 21st regarding that assessment. And within 48 hours, we had that information out to the members. So it took us approximately 30 days to work through the information received, to confirm the accuracy of that information, and to be able to lay out multiple scenarios in order for the board to make a decision. And within 48 hours of that decision, we came out with the information.
Additional, Mr. Newbridge?
Yes, you said you used 7% for your forecast. What are you using now?
We haven't set rates for
But
next year yet.
One could guess 13 to 19% based on the numbers that we just saw a few minutes ago by your preceding speaker, that you're gonna have to do that or else your 30 million is gonna go down again, right? I mean, if you don't set the rates at a level that pays for all of the claims, you're gonna dip into those reserves, and when those reserves hit 10 million, you're going to assess everybody again, is what I would think would happen. That would be the logical thing. So I'm asking what your plans are.
Let me put it into this context. We're relying on actuaries. We have a number of folks looking at this. The regulators have their own actuaries that are reviewing it. So whatever number is ultimately chosen, we will be reporting to the membership at public hearings what the recommendation is from those experts. And we will be moving forward. And the intent is not to have another assessment. The intent is that this is one time, and this, coupled with a number of cost control features that we are working on and savings that we're working to bring back into the program, it is not expected that another assessment will be needed.
Your original plan was to rebuild your reserves over 3 years, and now it's, basically over 3 months, otherwise interest gets accrued. I understand your point about, you don't want people to leave without paying, but did the board consider, and what would be the consequences to school care if this was spread over 2 fiscal years without interest?
So there were a number of scenarios that were considered. Those included multi-year assessment as well as adding to the rates. And it was determined that that was not a fair and equitable method to do that to the members. And it's really not about what would this do to school care, it's what the impact to the members, either that stay in the program or leave the program, have to pay for their losses. We are also considered fully insured. And we had been provided an indication that the rates would be 14% higher than they are today if it was a fully insured program. And in addition to that, we would still need a assessment because we did not have enough funding to get through the year. And then you're at the whim of fully insured, which means the benefits that are negotiated in your collective bargaining agreements would no longer be available because we'd need to offer whatever the carrier has as a standard plan. And then this assessment was considered, and then more extreme, there was a discussion about whether school care should dissolve, whether it was actually providing a value to its member political subdivisions. And about 3 weeks into the process, the board did remove that as an option because they do believe that there is still value by the members who value this, that we should continue going forward.
Ms. Sadowski.
Thank you very much for your presentation. The acceleration of claims cost in the final quarter of 25 really does worry me. Is that typical that you see clumping of costs in the final quarter like that?
So we've been doing some analysis, actuarial studies, and what we are finding is that there is, it's not relativity, seasonality. Like, I can't think of the word right now. Seasonality in our claims. We've looked at the last 3 years of claims experience, and we do have some seasonality factors to help us better understand going forward what the claims look like in that last quarter. So when you think that you're okay 9 months into the program and then you see this, we're now seeing that our program is experiencing seasonality.
Thank you.
Go ahead.
I also was curious about, you said that you're pursuing a line of credit while you replenish your reserves. You've approached a bank. You're confident about securing that line of credit?
We're not yet confident.
Thank you.
No.
Okay, appreciate it.
Can I ask a clarifying
Ms.
question
Fisher.
just for my own understanding of this? The contribution holidays, that just to understand that was because of the RSA that says that if there is a profit, it all has to go back to the organization.
That's correct.
That does, I can't say that I've read the RSA specifically to understand that, but that couldn't then go into a pool of savings, like a trust fund, that
So
would then be
school-
saved and still be given to the members.
Wonderful question. School care does not have the authority under the New Hampshire law, RSA 5B, to be able to do that. That would have to be determined at the local level.
Okay.
Is there a limit on how much you can keep in claims reserves under the law?
what I would say, is, it says that you have to have an actuarial analysis, and it's not specific in terms of what you can keep. What I would say is we had a risk pool practices agreement back in 2012 that allowed school care to keep, and I'm going to get a little technical, actuarial reserves at a 95th percent confidence level using a stochastic methodology, and that's what we've maintained. That for school care since 2012 has kept us somewhere between 14 to 16%. And so to answer you even more directly, because then I got to jump to that, yes, we've maintained that amount, and that was the amount we were allowed to keep, and anything above that amount we've been returning every year. And that's why from 2012 until 2023, we had returns annually that exceeded that percentage.
And so it's been, did I get the number right, 30 years without a risk pool assessment in New Hampshire? Did I get the wording correct? And why is that? Is that because of New Hampshire requiring that, or is that?
We had no need. We always had either surplus, or prior to contribution holidays, there was something that was utilized and deemed by the Supreme Court to be not legal under 5B, which was rate stabilization. So we held reserves, and then we stabilized the rates, but it wasn't a very transparent method. So if we took, let's just say, instead of returning 10 million, we used that to bring down the rate increases, it wasn't considered transparent. And so combination, clarification in 5B, and a Supreme Court case that eventually concluded in 2014 said that's no longer allowed. But we had already entered into a risk pool practices agreement and complied with the state statute prior to that.
Okay, so you as this school care who manages, am I correct, getting this correct, Cigna? Cigna is the health insurance carrier?
So school care is formed by the members, and we're the plan sponsor. We're taking in all of the contributions from all of the members, and we're using Cigna as a third-party administrator. So Cigna, we're renting their network, they're adjudicating the claims, and when they pay claims, they pay them right straight out of school care's bank account. They take the money that we've collected from Concord School District and all of our other members, and that's how they're paying the claims.
Okay, and do you have to pay Cigna for use of that?
We do. We pay them about 2% for an admin fee.
Okay, and has that rate gone up? Like, what's
Actually,
Cigna's role in this?
we've been doing some analysis lately, and it's gone down. And through the negotiations with Cigna, they're actually coming down even further on the rates, the admin fees.
Thank you.
Further questions?
Yeah, you said you had some additional members in recent, have you had people who have indicated to you that they will be withdrawing from school care?
We have not had any members yet indicate that they are withdrawing.
Thank you.
Further questions? Well, thank you both for coming this evening.
Thank you for your presentation. Thank you for your
Thank you.
information.
Mr. Dunn, do you have more for us?
Do you have answers for me? No. We have some things for you to consider.
Thank you all.
Thank you.
Thank you.
Thanks. Oh, must be interview time. Okay.
Yep.
I'll hit some things from the finance meeting for the rest of the board that's here, and then we'll go into the assessment and two other issues to address and kind of some of the stuff, get feedback from you. So history of these meetings, I've added this meeting. This is the first time where I've added another board work session, significant event. So we've added that. As of right now, we have proposed and posted for October 8th for you to finalize your budget, just so you know. For 2025, our end of the year, it's being audited now. They have not said that we're not correct, but they haven't finalized the audit. The 2.8 million in the unassigned fund balance that you need to carry over to make this budget work, we've hit that number, okay? The auditor is the same auditor we've had for quite a while. We've bid it out about 3 years ago. They've just had a gyration of names because of acquisitions. So they've gone from Melanson and Heath to Melanson to Markham to CBiz now. It's not that they're changing auditors because we're bad. It's because the market, okay? And they were on site from the 22nd to the 25th. They were remote on the 26th, and we're still providing them information. Our DOE with the state has been filed and submitted, so that is taken care of. This, I won't go into detail based on the time, but I can answer any questions. This is just proving out what the expenditures were at a high level. I'll have more detail just with the auditor, and then getting hit with this last Tuesday. We've not finalized enough that I feel comfortable bringing forward to make sure we're all on the same page. But your expenditures, your revenue, the key is you have 2.8 million to carry over into next year. For 2026, so this is where we'll get into some things. Again, we've posted the meeting for the 8th. I have a reschedule question there, just as what you start to think about things. And there's options to keep that and do other stuff. Remember, you took action at your June 25th meeting to put money into a reserve, and then we were to take it out as it relates to some functions that we're looking to do with the electric chargers and infrastructure, okay? Remember, we need 7 votes in the affirmative to make whatever changes you desire. So if we do not have 7 votes, some of the impacts that will happen because the DRA says they have to happen. Okay.
And where would the $2 million fall into that? Would that be just automatically added to our expenses, or would that be some money that DRA would
Well, it's not
say we would automatically have to make up?
Well, it's not appropriated, and it wouldn't be something that they would have. So I don't think DRA is going to force us to do anything.
Okay.
It's the ramifications.
No.
But yeah, I know you're not compliant.
No, my question
Nobody's
is,
gonna
it's
force
like
you.
if we haven't figured out
Correct.
cuts, does it get added to the tax rate? And you're saying the answer is no, it
No,
wouldn't
no,
automatically
I
be
will
added
show
to the
you
tax
what
rate.
will impact the tax rate.
Okay.
Okay.
Thank you.
You're welcome. So as we look at the drivers for 2026, student services, out-of-district transportation, right now, it's very hard to predict, but we are going through each of the 29 that we are transporting. At the end of last year, we had 81 that we were using a third-party transport. So we're trying to keep that at 29 or less, or fewer. So we'll work to do that. We have 25 invoices that have just recently come in, and I'm gonna need 150 out of the special education trust fund. So that'll be a one-shot, but we'll need that to pay those invoices. When I look at facilities, I'm still getting an answer on snow plowing as it relates to over 2 inch and less than 2 inch. Our utilities, this is the first year that we're running Concord High School with its new systems. I don't know what that's gonna wind up being, but we do have 100,000 coming in from your energy risk reserve, which has about 350 in it, coming in to support it, but I'm just warning, because I don't know what that's gonna look like, but we'll start trending that. And then obviously facilities does have a little contingency. I will be requesting additional contingency based on some work at the high school that's come up. And then as we talk with transportation, if you remember, we had money for the charger that came from insurance proceeds and money we were going to take from the school building maintenance fund. All of those things from thereof don't impact the tax rate. These are just coming from your reserves to take care of one-time expenses. So that's the good part. When you get to the healthcare and the mid-year assessment, that's where you have options. And as Pam mentioned, we're probably in a better place than other districts, but it's whatever you decide and how many options you want to develop. But for you, at least you have options, okay? When we get into revenue for state adequacy, our state adequacy came in $670,000 less than what was given to us last November 15th. And that ties to the extraordinary needs grant portion of the state adequacy. And I have here, I didn't have time to make it too pretty, but this I'll pass around as the breakdown that comes up with that 670. I haven't written up a narrative for that yet. I just haven't gotten to it. But that amount, if we do not adjust for it, that is where the DRA will step in and say, you're getting 670 less, the tax rate's going up. So that's one. The CTE caps, we mentioned to the finance committee that districts are capping how many kids they're allowing to come. Tuition agreement enrollments, that's specifically really where I'm getting into is Deerfield, because they're down to 23 kids and they used to run between 40 and 45 students. But with this new agreement, that has dropped to about half. There is things, well, not necessarily, I don't know why I put it under revenue, but this is more for your balance sheet. GASB 101, which is something that is being implemented this year, was passed in 2023, where we have to track compensated absences. And I'll have more on that because this is the first year we're doing it with the audit, and we'll give you that kind of detail. Similar to New Hampshire retirement, there's a value to what that post-employee benefit is, and that's on our books. This is similar to these compensated absences. And then the EFAs, trying to determine if they're having any impact on us as it relates to flexibility for people to move, and whether you want to look at programs where we want to try to apply to accept that money, depending on the program. Not for an answer tonight, but I'm just throwing that out there. And then the other thing is the city valuation. So the city valuation actually came in less than what it was last year by $473,818. So instead of $4.79 billion, it came in at $4.789 billion. So that is something that will adjust the tax rate as well, okay? You've already had your presentation by school care. The adequacy reduction, I passed out that detail for you to take time to look at that. And the city evaluation, I'm going to send you a sheet that we've put together. I've handed something like this out before and I maintain it. But this shows you what those valuation percentage increases have been in the past, or decreases. But basically it went down 0.009 and we had projected to go up about 1%. So, for example, last year it went up 2.03%, the year before 0.78, and usually we're pretty conservative, but we were on a trend. 2022, 0.84, 2021, 9.95. So you see those valuations. I can't, in this chart, I don't delineate what was real and what was market growth. We usually don't know that till November, once all the assessment has been completed. And as I mentioned to the Finance Committee, we're doing this early this year, if I didn't get a chance for the whole board, because they have a staff member who is going out on leave, and they want to make sure this is done before that leave kicks in. So that's why they've asked us to try to be done by October 15th if we can. A lot of stuff is in place. I did talk to the Deputy City Manager of Finance and told him about this was coming, so we might need some flexibility, and they're fine, they understand. Okay. I have on here your trust reserves and the projected balances at the end of 2026. One thing I will highlight to you is of that 2.8 million that I mentioned that you have to carry forward for this year, 2 million of that, 2,006,869.08, that's that FY25 transfer out column, is made up of that 2.8 million. Again, when we were over with the out-of-district transportation, 1.8 million, some student services over by a couple $100,000. We're going through everything right now to try to figure out, to make sure that that's not going to happen again this year. You do still have a special ed trust fund balance, which will, right now is projected to be $1,064,000 after this year. So there is some support that if we get to the end of the year and you wanted more information as we go throughout the year. So October, you'll see some things at the initial, what's encumbered at the monthly board meeting, but we need to go through and review that and find out, is all that really need to be encumbered, or is that because we have somebody in there? Because it's a significant number. Okay. For 2027, and then we can go back to 26, just things to think about. The health insurance you heard tonight, we'll see what those premiums are. It will not shock me if they're double digit.
Yeah.
Okay. You do have negotiations with 2 bargaining units. Again, that CTE sending cap is still something that we need to think about. Special education, open enrollment, whether the legislature winds up passing that in the end for public schools, we need to begin preparing for that. And then Deerfield, I anticipate you're going to hear from them soon because they're in the second of a 3-year contract, which as a board they're allowed to approve. Otherwise, it's got to go to the voters. I don't know what they're going to do, but we're anticipating that will affect in some way, even though you'll be in their 3rd year, we have to start thinking about what we'll be wanting to do. And then you have I handed out a document about as it relates to special education funding and the minimum of 80% that they have to fund now. Before they've done in the 60s of their contribution, so they do a percentage of a percentage. But now they've put it into law that they can't do less than 80.
Go ahead.
I'm sorry, Jack, could you repeat that last sentence? Who funds 80? Sorry.
So the state has to fund this, the special education aid, they have to fund a minimum of 80%.
Of costs over 2.5
Yeah.
times average
Yeah.
cost per
Okay.
student.
And before it would be a number of whatever that formula is, but then they do a percentage of that, of whatever that portion was.
Okay, thank
Now,
you.
apparently they have to do a minimum of 80, so we're gonna see, but we won't see that till next year.
Well, and
It
also-
won't affect this year.
If they're required to do that, then they could end up prorating
Something else.
something else.
Sure.
So it could come in one way and then just,
Yeah.
they'll take it away another way. They'll prorate something else lower.
On the city side, they have the citywide reevaluation going on, so that should probably be complete by next tax rate setting. It's a 2-year process, and they're in year 1, getting ready to go into year 2. And then on the federal side, we're being told the Medicaid rules will be changing July 1st, 2026, and they will be doing random moment time studies, and we're going to find out what else is changing for those. And then grants, we'll see if it still stay the way it is, if the Department of Ed still exists, do they convert to block grants? In answer to Pam's question, from everything we are researching and finding out from the state and from the federal, if there is a government shutdown, nothing will be impacted, at least from what we've been told so far. They all have their money, so
As an aside, have we gotten notice on Project Aware?
yes, it's all clear.
Both
Yeah.
of them are.
Yep, both are
Great.
in the clear. Yep, got that the other day. Yeah.
Just need a little bit of good news.
So, yeah.
Congrats.
Thank you for that.
We'll talk about all the money. That's even bigger.
All the money, yeah. Of the, what is it, 6,
Oh.
7
Yeah,
million?
we got all
Yeah.
the money for
Yeah.
repair.
It's all in the
For the
account.
I know,
remaining
isn't
time of
that
the grant?
great?
That's
Yeah.
great.
So I asked if I could take the 2 million from Ellen,
No.
but she said no, so I tried.
Ellen is good.
Well, it has a very specific purpose, so I was, yeah. So that's that, and that was the end of my presentation for finance. So I will go back to your trust fund slide. You-
I think it would be helpful to say, to have the one big number. What's our?
Bottom line it.
What is our bottom line shortfall now from the budget we passed in March?
All in,
All in, with the assessment, with this, how much are we?
about $3 million, because you got 670, plus if you have to make up for the valuation decrease, you're probably looking at about another 400,000, so there's $1,070,000, and then 2 million,
Okay, so just 3 million.
about 3 million
Ball-
something,
okay.
ballpark. So if we start taking this in steps of how I was trying to begin mitigating this, I just have my little notes here, I'm not projecting on the screen. If we did adequacy and just needed to account for that and the valuation, because I'm giving you in the order we've started to find things out. Adequacy, if the valuation came in what you projected and all, that'd be about a 75-cent increase versus your original per thousand versus your original was 61 cents. Okay, so you're another 14 cents. Then you have adequacy and the valuation. Instead of 75 cents per thousand, it's 90 cents per thousand. Then if you go and you add the healthcare on, it's $1.31 versus 90 cents. So I understand sometimes it's difficult as it relates to those reserves and holding that money. There's a reason why it's there, and you're very fortunate to have done what you've done. Because if not, you'd be holding the bag for all this. And I know you would feel terrible. So we have options to discuss.
So without touching the trust funds, which are there for exactly this situation, we would be over double the increase that we had originally planned in March.
Yep, correct.
And the increase we originally planned in March was?
No, you were going up 61 cents. But that's just the local rate. State's hovering around. It went up a penny. Instead of $1.58, 57, it's $1.58.
How much were we budgeting in the 26 budget to carry over to 27?
2.8 million. No, 25 to carry in the 26.
No, I'm asking 26 to 27.
Well, we haven't started 27 yet. But how
But-
much will we?
How much, we had a number, an estimated surplus at the end of 26, what, in our budget originally, what is it?
It was 2.8 million.
2.8,
And that's exactly what you got from 25.
right, and so we're estimating going over 2.8 to 26 to 27, in an ideal world.
Yeah, in an ideal world, you'd carry about that. I mean, ideally, the state allows you to have up to 5%. I've tried to keep it between 2 and 2.5 because you have the power of having those expendable trust funds. And because you have that, there isn't a need for us to carry a large unassigned fund balance. So you put money away. But yeah, that's about what it'd be. Between 2 and 2.8, so 2 to 2.5% is what we try to do for you. But you could use some of that. You could draw that down and say, I'm not going to use 2.8. I want to take 800,000 out of that unassigned fund balance. And yeah,
I was thinking.
yeah, you could do that, absolutely. You could also put some mechanisms in place where it's up to and see where things go. If we put in budget freezes and some other things we'll mention to you, but sorry.
That's right. So I think this gets at the root of like what our next steps in this specific meeting is. So this was a finance meeting that turned into a full board meeting so that we could hear from school care. Sounds like you have options for us on how we make adjustments. We have Brenda on the phone in the middle of the night in England. So thinking about like, what is it that you are asking from us tonight? Are we expected to make some kind of vote on acquiescing to the demands of school care? Are we supposed to, as a board, all drink a cup of coffee right now and get into the thick of like our trust fund options?
I think it's important, we have a budget meeting scheduled for next Wednesday to finalize the budget, which we can put off if we need to, but we have noticed it because we have to give 10 days notice for that. So I think what I was hoping we'd get at is like at least a start of outlining some options so that board members have some time to digest that and ask. And if people have additional options they want to put on the table, to ask, to be able to bring those up, to ask the staff to get information so that we have that next week when we meet. And next week if we meet and we think we continue to need more time, we can continue that meeting.
You can recess and continue it.
That meeting to a
announce
later
it.
date.
Yes.
So I think the goal is to at least give people an idea of some of the options so that, you know, the public can know what's out there and we can think about it as well.
Are there votes that are needed tonight?
I was not anticipating any votes tonight.
No.
So again, just thinking about sweet Brenda.
Thank you.
You're welcome.
So we just wanted to see, was there anything really that was off the table? You have options again to go for the assessment or other things. Your trust funds, you can dissolve trust funds and take that money and reprioritize and create new trust funds. So if you decided you didn't want to take the health risk reserve and basically knock that down to nothing, you can take something else. We've started to create a list of budget freezes that we would look to say we're gonna implement, not hiring positions that are open. Some of that we probably won't have a choice, but just the general fund alone has 1.9 million in salaries that are not spent yet. Obviously, that will lower your unassigned fund balance of what you carry over for next year, but that, we've looked at, some declining balance POs usually we do at the end of the year. We would look to eliminate that. Maybe reorganizing some staff as it relates to supports at the school, if that can work within the CBA. Again, relooking at all the transportation, all the special ed to make sure what we're obligated to do, we've done. Eliminating any use of third party, which could potentially mean canceling trips. If our bus fleet can't do it, it doesn't happen. Got to know whether that's on the table or off the table.
I mean, it's hard to know without knowing what the numbers
Sure.
are that
Yep.
associate
Yep.
with that,
Yeah.
and what the impact is. Does that mean we're telling our teams that they're forfeiting games?
Right. And when you get into the middle school versus the high school, it's different because you have governed by NHIAA versus the middle school, it's different. I will tell you this, we've already spent $5,000 in charters already, and we're only the first month in the school. You're looking at $600 to $1,000 when you outsource that, if we don't have a bus driver. So, last year, we didn't do that until we got to the spring where we had to do it. We probably spent between 3 and 5. But if I'm already spending that now, and we're building up the driver fleet, but are we to say that that is not an option? That's the question. So, on the good news, we will be increasing the CRT sending students by 20, because we reduced that in the budget, because we didn't know all that was happening. Those numbers are coming to where, because if a district capped, another district filled in. So that'll be about 162,000 increase in revenue that we're gonna account for. We have 2 additional Deerfield students that we have that we did not account for, because we did a conservative number based on where we were seeing that come down. That's a little over 40,000. We have another out-of-district tuition, that's about 11,700 that we have. And then the one number we do not know yet is our special education aid for this year. That will be known by tax rate, so that's something that would be, we're trying to get it. We can't seem to get that number, but that would help us, because right now we budgeted 650, but say they pay 8 something. I don't know what that pool's looking like, claims look like. So it'd be nice to have that number so that you know, okay? I think I covered everything that I can touch upon at the moment.
I mean, I think from my perspective, everything that is, sort of everything is on the table situation. But I'm of the perspective that I'm not sure what is off and on the table. Like if I say, cut all the buses, and then you come back and you're like, no, we can't. That's not something that's up for negotiation. Like, I'm wondering if we can start from a place of like, what is possible? And that way we can really prioritize, right? If the sentiment here is we got to start laying off teachers, and you're like, nope, we can't do that.
Everything I'm touching,
know.
I feel is doable. It's just a matter of enforcing it.
Could we put together a list of potential costs of what this will bring to offset these deficits, and have a rationale within a projected impact, and maybe give you that to mull over?
Yeah.
Try and get that to you.
Yeah. So, to just follow on what Kara was saying, to me, most everything is on the table. I want to see some options. I don't want to lay off teachers. I don't want to do that if we don't have to. I would not want to trust, looking at the numbers, I don't want to hit the special education trust fund, because that's one of our biggest unknowns, and something that we're just gonna have to, if we don't have that and something, we have charges that we haven't inspected, we're just gonna have to pull from someplace else anyway and do something like that. But this is what we have trust funds for, so I would look at all the other ones.
It's more of a statement than anything. the sooner we have the options, I know you guys have a lot on your plate, the better. The sooner we socialize them with our community, the better, just to give not just us, but our community time to digest and provide us feedback. And I'll just say from my personal preference, if this year is going to be tough, next year is going to be even tougher.
Yes.
So the more conservative we could be this year, albeit as hard as it may be, it will only help us fiscal 27. So we need to.
And going back
yeah.
to like the teacher, well, they're off contracts. 80% of your
Can't do
budget,
it. Yeah.
that's locked. Everything we're looking at is stuff that means people are gonna have to, we'll be asking people to step up because there isn't an assistant or there isn't this position that we're filling. And we've gone through that. And the other thing we thought, if we reduce it, is it something that we're saying it's reduced in 27? Because if it's,
Right.
it's a false premise if we lower it now to
Exactly.
make this work and then we bring it back next year because
Yep.
it's just gonna be that. So we've already started doing all
Thank
of
you
those things.
so much.
So I would target, positions that are not filled.
Yep.
And then I agree with you on the fact that, eliminating that, you may need to relook at reallocating those that are filled to fill in, to balance it across. It's a big job, but I think that's what I would do right now because, we need to make up a fairly good chunk. Not your fault. It's,
Right.
been thrown on us suddenly, but that's the times we're in. So, yeah.
Though I'm just concerned about drivers. If we're still looking for transportation
We are.
drivers, we need the drivers.
And I think any hiring freeze, and I think we should think about a hiring freeze and a travel freeze and, purchase, but there's always there has to be an exception policy as well, if a educational assistant is required as part of a student's IEP, then we need to hire that educational assistant. If we can find them drivers, I think definitely would be an area where I would say, especially because the cost of not having the drivers is so much more than the cost
Well,
of the drivers.
Our thought was getting a consensus from you that stuff is available and start
Yeah.
implementing that right away. I mean, we've already thought to say, but we wanted you to hear those things in case they come to you, that you're on board with that. Again, we're trying not to hurt anybody that's here. That's not the goal. It's to get the kids to school and educated and fed. But are there things we're gonna have to tighten up?
One area, I think we should definitely look at as well is our contracted services and where we're bringing in people to provide services and whether there's ability to reduce costs there. Whether we can trim some of our professional development costs for this year.
That was on the list, yeah.
We provide, without reimbursement or adequacy aid, services to students at charter schools off-site, and we pay additional costs to send people off-site to do that. I think we should look at only providing those services on-site and what that would mean and what the cost savings that would be, and if the state believes we should be providing those services as part of an adequate education, and they can fund that. And have enough understanding of what those costs are.
So the amount we reported on our DOE 25 for providing services to charter was over $300,000, just so you know.
And that's in addition to our regular staff, that's not like, so.
Okay.
So I think those,
Yeah.
And all discretionary items should be deferred if at all possible to another year or several years.
going back to Ms. Campbell's point of wanting the community to sort of know what's on the table, and I'm sure the monitor that is here will report some of this, but how do we get numbers and information out before we have a public hearing next Wednesday? You know, to the board and so that people can, you know, see the list of options, and if there's one they care passionately about, so they know to be here before we vote. You know, I don't want it to be a surprise to
Right,
people, and
I
I think
know.
we've listed the full array here,
Yep.
but,
Yep.
you know,
And to our faculty and staff.
Yeah.
No surprise,
Well,
yeah.
we were talking about sending out a message tomorrow morning
Okay.
because we didn't want it to be a surprise.
But we're not gonna have numbers that,
We're only gonna have, these are the things we're getting impacted. We can have the list of things we're considering and what that, totals.
I think it's,
but-
if it's okay, just an opening discussion, because you guys have already said things that some people can interpret in certain ways. And so we want people to understand there's a process.
Right.
And that you're being thoughtful about it. But, I mean, somebody already said, are we going to lay off teachers? That can be a question that gets put out there with no answer, with no context.
Yeah, and, well, I
So-
think the answer we've just said is no.
Right.
But that's, right, that's correct,
we're
but
not
you
gonna do
know
that.
that there could definitely be a Facebook post.
Yeah.
So I think we were thinking about putting out an initial message that just said, especially this surprise assessment was already in the news. And so just saying, hey, this is what's happening, and you're going to hear more. And as you guys talk about the process, then we can let people know what that is.
Well, and to that point, because I did make that comment, because I'm thinking about other districts that had surprise costs.
Absolutely.
And we're talking like school closures and layoffs, and we need our community to know what our priorities are. We need to vocalize them so that we know that we have trust funds and we have areas of the budget that we can work on, so that we're not in that situation where we're at that point. Because I feel like community members have been shocked by, I can't believe we're here already. So I think it's worth it to just like vocalize what our priorities are, vocalize, like, because each individual member can state what their priorities are and make a case for that when it comes to cuts. And it's worth having the conversation. And I know all of these are very sensitive topics. And I do think that we are very fortunate that we are not there yet, but I think it's worth it to have that conversation so the community understands the work that we've done, so that we're not there yet. And will continue to do in the future fiscal years.
can I ask a
Yeah,
question?
Mr. Richards.
I'm just asking to the board, can we realistically do this in one meeting on the 8th?
And that's my concern. I think we could do something on the 8th, but then I don't think people have an opportunity to.
Precisely.
And my concern is the potential misinformation that could happen, or alternative facts is a term I've heard, where maybe you schedule your budget setting on the 15th and we repost it for that and leave the 8th in place so that you have time. Because if things get volatile, I don't know how good I'll be on the fly to be able to change.
And I understand that 15th is the city's date. It's like
Yeah,
the
but-
one day I can't do.
Oh, that's right. That's right. I remember you saying you were gonna be away, yeah.
I can do the 16th.
I'm fine with that, and I've
I
asked
know
them for
there's some
flexibility.
conflicts with other board members, so we could potentially do the 20th.
But this way it'd be clear what's gonna happen, rather
You're not
than,
back.
is the 8th, is it not, and you're hearing things, and public hearing, and
Yeah, that's fair.
it would give you a little bit
So
more.
we'll have to sort of socialize
Okay.
dates.
Can we,
Okay.
I don't know, aren't we meeting on the 6th as a general board? Could we just say, sorry, we're not gonna do celebrations, we're not gonna, we're gonna focus on this. We're gonna have the discussion, and then we'll continue the conversation on the 8th, because,
Yep, we
I
can.
mean, the meeting that we had to set the calendar for October was difficult enough as it was. I don't know if we can
Yep.
add another meeting. We've got info sessions at the middle school.
Yep.
We have,
Yeah,
like.
I'd prefer that.
And so, I do believe that we have general business to get through, but if we go 1 month without a superintendent's report, so be it. Because this is the
Yeah.
report,
This is
right?
a report.
All right, well, we will look at the agenda and trim it up. Okay, so that's what we'll do. We'll have further discussion on the 6th, plan for the budget meeting on the 8th, and if we're not ready, then we'll
Then we're not ready.
figure out another time. We had the 28th held, and I know, so that's still an option.
Yep.
So I want to just make
Like
sure it's
29th.
clear, probably not to you guys all know, but I want to make sure it's clear that, we are looking at all things and looking at a broad range of things, but this is why we have trust funds, so that there isn't a tremendous cut or tremendous shock to the community. those in the past who have said, why do we have trust funds and they don't like us to have trust funds, this is precisely why. And so we do have options that will not hurt students, teachers, or the educational programs, and I want that message to be out there for our parents as well as our community. So thank you for letting me say that.
Thank you. I'm going to open it for our required 30 minutes of public comment. Is there anyone who would like to comment? Seeing none, I'm closing the public hearing. Anything else that folks would like to discuss tonight?
Thank you so much.
Thank you.
Yes, thank you in advance for I know will be a busy week.
Okay, good.
Every week's a busy week, turning out to
It
be.
is.
Yeah. All right.
I have a question when you have a moment.
Oh, Brenda.
Yes, Ms. Hastings, go ahead.
Jack, would it be possible to get me authorized to get emails? I can't get my emails here right now.
Yes. Yes.
Okay, thank you. That way I can keep up with what you all are doing, and the notes that are being sent
And
about
Ms.
this.
Hastings, do you need to be remote on the 6th and the 8th, or are you back?
I am back.
Okay, great.
I need to be remote on the 8th.
You need to be remote on the 8th, okay. So that request has been received. All right, anything else? If not, I will take a motion to adjourn.
So moved.
Moved by Ms. Sadowski, is there a second?
Second.
Second by Ms. Boucher, is there discussion? All those in favor?
Aye.
Any
Aye.
opposed? Motion carries, meeting is adjourned. Thank you all very much.